So the purpose of the visit this morning was to educate myself about where are we in South Carolina when it comes to telemedicine. The disparity in the African American community and other minority communities in healthcare, I think, can be bridged in many ways by robust telemedicine. Dr. Cole has been on this for a very long time. MUSC was there before it was cool. I've just gotten $30 million grants for a telemedicine center of excellence, and we're one of the two. But my goal is to have broadband available to every part of South Carolina, which will exponentially increase the ability of telemedicine. Just think of the number of people who don't have to drive to the doctor anymore, which makes them safer, less cars on the road, quality health care without you having to leave your home, an intimate conversation with your physician in the privacy of your home, not only, I think, is going to save money, it's going to save lives. So I'm really excited that in phase 4, and there'll be a phase 4, that we need to focus on broadband capability for rural and urban poor areas to maximize telemedicine. And I think of all the models in the country, MUSC is probably way ahead of everybody else. And I'm going to let Dr. Cole talk about what they've been able to do during the shutdown. They were able to recapture much of their business through telemedicine, which means people, healthcare outcomes were better. The other thing we talked about is Charleston is one of the best destinations in the world, not the country. And if you're in the hotel business, if you're in the restaurant business, if you own a bar, these have been really difficult times. You see things coming back, but we have Will from the Chamber. I want them to share with the community here the barriers to coming back. What does it take for the hospitality community and the Chamber to come back strong? What can we do in Washington that we're not doing? And what kind of confidence do we have to achieve in terms of travel? I don't think you're going to have a comeback until people really feel confident they can travel without getting sick. And I think we'll be there before you know it. But if you don't mind, we'll start with Dr. Cole, and he can showcase what the last couple of months have been like and what could be the future of medicine.
Thank you, Senator. I'm sure you're aware MUSC is one of 2 centers of excellence in the nation for telehealth. And that actually is not just MUSC, but it's for the state in terms of that resource. So when COVID hit, we and everybody else have been, I think, economically hurt by the virus and what that looks like. And from our perspective, getting to our patients, providing health care, and actually having, I keep using the term, non-viral related COVID deaths. You know, patients that don't have access or maybe out of fear can't come to the hospital or come to see and get the care that they need. So we have wonderful teams in place already and have been able to actually go from a presence of telehealth to now half our clinic visits are in a month's time. We're able to ramp up, train our physicians, get access to, and provide virtual care for our patients. So there's been many bad parts of COVID, but sometimes it also forces you to be your best. This would be one example. And I'm really proud of our team and the people. I don't know, Dr. Cole, if you want to say anything further that I might have missed.
Thank you, Dr. Cole. Thank you, Senator, for this discussion. MUSC has had a center for telehealth since 2013, when the state started to invest in telehealth. And we've developed that, and good for us is that when COVID hit, we were able to pivot very quickly. So other health systems around the country and really the world have been trying to pivot to telehealth, but because we had this internal expertise, we were able to move very quickly. And as Dr. Cole said, got back to about 85% of our outpatient visits, and half of those today are done by telehealth. This is not just for COVID. This is for going into the future. This will improve access. It helps people get to the doctor and the nurse quickly. They don't have to take as much time off from work. They can do it from the safety of their own home. But 2 things are really required from our perspective, and we had the discussion about this today. Number 1, we've got to have better broadband across the entire country. And we want to see that especially in all of South Carolina, not just where population is, but where all the South Carolinians are. And then the second thing is what we would call payer parity, meaning whether the patient is in person or the visit's done through telehealth, it's paid the same. So that's an important concept that's helped to grow telehealth during this time of COVID. Most insurance companies and most payers, including the federal government, now pay in the same manner as an in-person visit. That's really important. So that was the discussion today, and thank you for having that.
Thank you.
Well, Senator, thank you for your very comments about Charleston being the #1 industry, and it's no big surprise that we have been really devastated. Of our 40,000 folks that work in the tourism industry, full 75% of them were not working at one time. And there are two big issues that you've been on the forefront for us. And first is that liability issue. We need some protection that is temporary and immediate for our small businesses, for them to have the confidence to open up. And secondly, it's the how the unemployment works. Right now, there's some folks that are actually making more money not working than they would make if they were working. So if you could help us with those two things, we would really appreciate it.
Well, thank you, Senator, for having us together today, and thank you for MESC for the fantastic job that they're doing. I want to say that people in our region, people in South Carolina, are ready to get back to work. And we think that employers can do that safely. We do want to make sure that they have the proper protection from liability. And we want to make sure that our employees know that they can come back and have a job and move forward. I want to say that getting this unemployment situation under control with the currently paying the additional money has made it very difficult for us to bring in employees from the entry level on up. So I want to make sure that we get that under control and that we continue to make that PPP bill better. Thank you.
All right. Just kind of to wrap it up, and we'll take questions. America will not be the same after we recover from this virus. We could actually be stronger. There will be some businesses, unfortunately, that won't come back. There'll be a lot of businesses understand that the employees do not have to come in to an office. Google and Twitter and other big companies are giving their employees the option of working from home. So America will be different, but in many ways I think we'll be stronger. And on the medicine side, what the last couple of months have shown me that with the right leadership and the right infrastructure, we can bring medicine back to your home. 100 years ago, the doctor used to come to the patient's house. Now having a doctor come to your home is about like going to the moon. Nobody believes that's even ever going to happen. But we can get the doctor and the patient to your home and reduce risk to you of having to travel, and I think have more efficient outcomes. The more preventive medicine, the cheaper it will be over time. In terms of the economy, I'm going to try to convince my Democratic colleagues that we're all in this together, that to reopen America, businesses have to be assured that they're not going to get sued if somebody comes to their business and catches the virus. You can't sue a company because you got the flu if you go to a restaurant. So what we have to do is make sure there's a regulatory system in place to protect employees and customers. And if the company follows that regulatory regime, they cannot be sued. We're not going to protect bad actors. We're going to protect people who are doing it right. It will be limited liability in terms of time, because hopefully the COVID will pass one day. But to get America reopened, you've got to convince the employer that they have legal protections if they open up their business to the public, but you have to also expect them to do the right thing. In terms of unemployment, I saw this coming from day one. Why? Because my family ran a restaurant. We had a bar, a pool room, and a liquor store, and I can tell you, if you pay somebody $23 an hour not to work, they're going to take you up on it. And they're not bad people, that's just the way life is. So I was the first one to reach out to Democrats and say, let's make unemployment more generous, because this could go for a while. We got 40 million people out of work. The maximum benefit in South Carolina is like $324 a week. My goal was to supplement that up to 100% of your wages to about $50,000 of income. So if you're making $15 an hour, I wanted to pay you the difference between $324, the state benefit, up to your actual wages of $600. What we've done is have a federal benefit of $600 on top of the state benefit. So if you're making $15 an hour working in a restaurant or a hotel and working hard for your money, you're actually making $23 an hour not to work. You're getting a 50% pay raise in unemployment, which makes it incredibly difficult to restart the economy, particularly in the hospitality industry. So I want to be generous to people who've lost their job at no fault of their own, but I also want to not incentivize people to stay out of the workforce. And this program has to be dealt with. It has to come to an end in its current form. So phase 4. If we don't put a lot of money and effort into broadband, we're crazy. Not only does it help us in the medicine area, it will help us in recruiting businesses to rural and urban poor areas. Senator Scott developed opportunity zones. These are places in America, urban and rural, mostly minority, where economic development is non-existent. So Tim got President Trump and everybody in Congress to sign on with the idea, if you'll locate in one of these opportunity zones, you'll have preferential tax treatment for a decade. It is working. But one of the things you need to make it work to its fullest extent is to have 5G. So I want every opportunity zone to be hot-wired with as much broadband as we can get. So Governor McMaster has made this one of his priorities. $90 million of the COVID relief money coming to the state of South Carolina is going to be dedicated to build out broadband in rural and underserved areas. And the docs have told me that if you could have an acceleration of broadband, telemedicine would go through the roof in terms of potential in this state. So with that, I'll take questions, me or anybody else.
Senator Graham, the hospitality and tourism industries aren't the only ones that have lost jobs, right?
Right.
The healthcare industry in South Carolina has lost many as well. How do you intend to help the healthcare industry get back to business 100% in the coming month or so before those benefits would expire?
Really good. I think y'all furloughed 1,200 people. Is that right?
That's correct.
Okay, they kept the benefit package, which is very generous. Able to bring their employees back when people begin to move around and the economy begins to reemerge. But I'll let them talk to you about their plan. I think they brought 300 back, is that right?
That's
so
correct.
If you can maybe give them some idea of where we're going there.
What we're starting to see at MUSC is slow, steady climb back to normal. This week we're sitting at about 90% of our pre-COVID activity, and with that we started bringing people back. And we've probably brought back almost 300 of the 1,200 that were temporarily laid off. I think every week we continue to grow, we'll bring people back. So my only worry right now is if the economy doesn't turn on, then we're not going to get back to where we are, and we won't be able to pull everybody back. But we have been seeing steady, slow, week over week improvement. So having to pull them back.
On a similar note, much of the provider relief funds have gone to hospitals, and MUSC got a pretty sizable amount, right? Dr. Cully, is that enough funding, in your view, to help kind of revitalize MUSC?
From our perspective, I think we've appreciated the dollars, and it's helped us through this time. The next set of dollars are coming from the federal government in different ways. One of the things that we like about one of the sets that's coming in now is to increase testing, because we think testing is one of the core elements of bringing back the economy. Everybody needs access to rapid testing if they get sick or they're worried at all. So some of those dollars coming in that we're going to be part of, because we've developed the ability to bring up pop-up clinics and mobile clinics and try to get testing out as quick as possible. So not all the dollars are going to be directly benefiting MUSC, but are coming through, and MUSC will be using those to develop testing capability.
Senator Graham, some of our rural hospitals have gotten less than $1 million and are, from what I'm hearing from the Hospital Association, really on the brink of closure. How do you intend to sort of help send those funds to our rural hospitals?
Well, the money is in the system, so before I do phase 4, I want to find out how phase 3 worked. A lot of the money hasn't been spent yet. We did over $300 billion for rural hospitals, and why did we do this? Outpatient surgery stopped. Elective surgery stopped. I don't know what the revenue stream for your hospital system was in terms of elective surgery. That all came to an end. So that whole line of revenue stopped. So that's why we need phase 4. Before I promise any more dollars, I want to find out where the money went in phase 3, right? Here's the one thing I know we're going to need more money for is testing. What does normal look like? We're not going to get back to normal, I think, until we get drug therapies that will keep people out of the hospital, will lower the mortality rate, effective treatments for the disease itself. When you see a vaccine on the horizon, people have confidence to move around. Testing's the key to all this. If you want to open up schools in the fall, then we need to have a robust testing regime. So one of the things that I want to do with phase 4 is put a lot of money into the ability to develop real-time testing. That's the key to opening up the economy, along with liability protection, along with reforming unemployment benefits. If you want to go back to normal, you can't pay people more to be unemployed than you do at work. If you want to go back to normal, you got to convince the business owner they're not going to get sued if somebody gets COVID in their business. If you want to change America in a fundamentally better way, invest in broadband and telemedicine. Because when this thing is over, we could actually be stronger on the healthcare front. But look at the number of people who have missed appointments, that delayed treatment, and there's a consequence to shutting the country down. There have been on the healthcare side. Anything else?
Yeah, you said in the other room that this is going to become like the flu. Can you expand upon that?
Yeah, we don't shut the country down because of the flu. The flu comes every year in different forms, and we can lose 30 to 50,000 people a year from the flu. But you don't get sued because of the flu. We still travel with confidence. There's vaccines for the flu. We build up immunity to different kinds of flu. There are therapies out there that help you if you get the flu. The flu can be fatal to certain populations. But just look at it this way. We've learned to live with the flu. We have not been able to live with COVID-19. And the only way you're going to be able to get back to normal is to have the paradigm we deal with the flu. Have a vaccine available, have drug therapies that work, and then you're able to deal with the consequences of the virus. It's likely to come back in the fall. So personal protective equipment, did y'all run out pretty quickly?
We were working hard not to. I would say that it's been a struggle ongoing.
So in the fall, I want to have a supply chain that we control, not China. They're making 3 million hospital gowns in Pendleton, South Carolina, Milligan Textile. We're crazy if we don't bring the PP protective equipment back in the United States for the fall. In the fall, I want to have testing far more robust than we have today. In the fall, I hope we'll have drug therapies that can lessen the effect on the human body. Take it from a 10 to 1, 2, or 3. And hopefully by the fall, there'll be a vaccine on the horizon. That's the key to me, for me to get back to a robust economy in the fall. And we got to deal with the unemployment issue, we got to deal with the liability issue.
So you're expecting this really not to have an ending point. This will be, I mean, how long do you expect these impacts to stay?
I'm not a doctor, but I've been told by doctors that viruses like COVID-19 tend to come back. And like the Spanish flu. It took 3 years for that to run its cycle. So I'm hoping that one day the world will be without COVID-19. I do know this, the day you get a vaccine for COVID-19, we're much safer. The day you get drug therapies that can, bomb the virus, we're much safer. So all the money we're spending to develop drug therapies and vaccines are well spent. Here's the strategy for the COVID-19 virus. Starve it, social distancing, wearing masks. It needs human transmission to survive. Wash your hands, be smart, and stay away from large crowds. That's starving the virus. Bombing it is a drug therapy. Come up with drug therapies that will lessen the effect on the human body, bomb the hell out of it, and the way you kill it is through a vaccine. So starve, bomb, and kill, and I hope by next year we can do all three.
And the biggest barrier you see going into this next phase that you are expecting to challenge?
Barrier on the healthcare front, I think, is going to be, do we have drug therapies and testing robust enough to have confidence to reopen our schools and to get back to a normal operation of society? I think on the healthcare front, if we have a breakthrough on drug therapy and we have testing, I think we're in good shape for the fall. If by the end of the year we have a vaccine that is promising, that would be the ultimate death blow to the virus. From the business side, if we don't deal with the unemployment disparity, where you make more unemployed than you do working, we'll never get back to normal. And if you don't assure these people in Charleston that if you open up for business and you're responsible as a business owner, you're not going to get sued, it's going to slow down the recovery.
You've mentioned a vaccine several times, which we're all working towards. Tell me, what role is MUSC in the state playing in getting that started?
I'll let them tell you that, but I just got off the phone to Bill Gates yesterday, or 2 days ago, and Mr. Gates is putting a lot of his own money with Larry Ellison, both these very wealthy folks that are investing in 6 promising vaccine trials and very promising results. We're not there yet, but I'll let Dr. Cole tell you what we could do here.
We've been involved with clinical trials, COVID-specific clinical trials for therapies and developing novel therapies. Vaccines requires lead time with specific companies that have the capability to do that, and they're ahead of us in terms of doing that. So we're going to support when vaccines come in, start heading our way. If there's an opportunity or need for clinical trials to expedite, we've got that capability. So there's therapies. There's actually how do you take care of the patients that are, now. We're in the middle of that national clinical trials and a lot of very, I think, innovative studies. So we'll see.
Where are we at on the therapy development, do you think?
There are, I would say there's 2 or 3 major clinical trials with therapies. For example, passive immunity is one that has promise. The drug, whose name is escaping me right now, that just got approved by the FDA is another one. I think the problem is with therapies, people are hopeful and you jump on something with very little evidence, right, and you really have to vet it and get enough knowledge to know how to deploy it, because any medication has risks and benefits. So as we get more time under our belt with these treatments, we'll have things that we have more confidence with. We'll get better outcomes.
We've talked a lot about testing also, and I know we talked about it a little bit in there before we moved out here. Talk about the testing that's been done in South Carolina and then specifically what MUSC has done.
Well, we have been, I think, first of all, MUSC has been working diligently to develop an incredible level of diagnostic testing capability. If you recall way back in March, we were all limited. Not only Stanislaus County, I think the nation was limited. So we invested a lot of time and capability. As an academic health center, we had to have a diagnostic test. You have to have the PCR machine platform. You have to have expertise. You have to have the reagents, and you need to get validated. So we were able to get, with help from our legislative leadership and federal leaders, to get exemptions from the FDA to actually get validated PCR tests. So we've gone from 20 tests a day to more than 1,800 a day at MUSC only. And we're now partnering with other companies and industries to be able to get that set up. By the way, in South Carolina, and I would say in any entity, a state, it's not merely getting the tests, they have to be reported in a timely and uniform manner rapidly. It doesn't help you if you have an isolated test over there and somebody reports it out 5 days later and it doesn't, you can't act on that information. So we've also been able to partner with DHEC and across the state to have a reporting system which is coming online as we speak, so that if somebody in the upstate gets tested and they get the test back, it'll come to DHEC and we can actually know what that means. So the reporting is vastly improved. Diagnostic testing, as I'm sure you're aware, we are involved with and have been asked by the state to partner with DHEC and South Carolina Hospital Association to develop and deploy a statewide testing plan. We've been working hard on that, and I think our main portion that's going to be rural and underserved areas, which we've already been deploying. We expect to have 16 different mobile testing sites by mid-June. That's going to probably be a year at least commitment, because you don't just test and walk away. You have to test and retest and look at what that is. We've been working with businesses across the community in the state. We've been working with school systems and universities to try to help provide best practice and knowledge of, how do we set up our classrooms? We can't guarantee things, but we can at least provide some knowledge or expertise, and also provide testing capability. And then I'll make one more comment. Antibody testing, I think, is an important adjunct to diagnostic testing. And there's been a lot of confusion out there in the public sort of eye, because there's a lot of tests that were early on, and understand a positive antibody test, if appropriate, means you were exposed and responded to the COVID-19 virus. The reason there was confusion is because coronavirus is the common cold. So if you have a non-specific test and you test positive, does it really mean you have corona or not, right? So the first thing you want is a validated test that is true positive. We've actually been able to develop in this state with our partners, USC, Prisma, and Clemson, of 100% true positive antibody test. We're deploying as we speak for the public.
Thank you all very much.